Shall I give the countdown, sir? Swati this side from Rahul's team.
Yeah.
Okay. 5, 4, 3, 2, 1. We all are live, sir. We can start the session.
Yes.
Good evening, all of you. And on behalf of EIZOC, I welcome you all to the 23rd Ophthalmology Resident Teaching Series. Today we have an interesting evening talk on oculo-facial aesthetics by an expert international speaker, Dr. Subra Goel from Apollo Hospital, Hyderabad. Moderator of the webinar is Dr. Rajesh Chaudhary, with an experienced team of panelists, Dr. Shramista Behra, Dr. Ruma Das, Dr. Chandana Chakrabarti, Dr. Mihir Mishra, Dr. Malay Verma, along with a bunch of enthusiastic discussants from different medical colleges of the East and beyond. EIZOC is extremely thankful to the mentor, Dr. Ajit Babu Manji, and Chief Coordinator, Dr. BNR Subuddhi, for their untiring effort. The constant and the consistent effort of our Secretary, Dr. Swaraj Bhattacharya, and Chairman Scientific Committee, Dr. Sabyasachi Patnaik, has been the strength of our society. And most importantly, I welcome you all to this informative webinar. So welcome all audience. And with these few words, I would also like to inform that we have the annual conference, which is coming up in November end, that is 29th, 30th, and 1st of December at Kalimpong, Darjeeling, West Bengal. All of you are requested to register for the conference that is going to be a 3-day affair. With these words, I welcome you all again, and it's over to our Chief Coordinator of this webinar series, Dr. BNR Subuddhi, sir. Over to you, sir.
Let me share this screen. Is it visible?
Yeah, it's visual, sir. Make it slideshow, sir.
It's going?
You can go for the slideshow, sir.
Is it changed? Has it changed?
No, it has not changed.
Okay. Sorry. Now, sorry.
I mean,
now
the
is
first
it
slide,
visible?
sir. The first slide we can see.
Second, sir?
No, second we cannot see, sir. It's not changed.
No?
No.
Sorry.
Okay, we can go with the
Yes,
same
it's
thing.
going.
You can just change the slide in the sides.
Can you see the second slide now?
Yeah,
now
second
it's
slide is visible now, sir.
Okay. So, good evening. On behalf of the EIZOC ORTS 23, I invite all of you. I welcome you all to this webinar series. This is 23 number, having a wide acceptance by the postgraduate students. As you know, every time we increase the number of postgraduates. So today's topic is a very interesting topic. It's an overview of oculo-facial aesthetics by none other than one of the finest oculofacial surgeon, Dr. Subra Goel from Hyderabad. This is our webinar. This is the EIZOC team. Our respected President, Dr. Pranav Ranjan, Secretary, Dr. Swaraj Bhattacharya, Dr. Chairman, Scientific Committee, Sabyasachi Patnaik, all the behind this, organizing this program. And of course, the role of mentor cannot be overemphasized. He is a great man, and he chooses the selective people to come and give us a very good lecture. And I don't know how to express my feelings towards him. So thank you, sir, always coming and guiding us for this program. And today's speaker, a dynamic young lady, Dr. Subra Goel. Many of you must be knowing her. So to say few words about her, She is the co-founder, CEO, and chief surgeon of India's leading eye and face plastic surgery clinic, Clinica 5, and Oculo-facial cosmetic consultant at Apollo Hospital, Hyderabad. She is an award-winning celebrity and a gold medalist oculofacial plastic and cosmetic surgeon. She is India's the first and youngest surgeon to receive dual fellowship in oculoplasty from US. One of the only 7 doctors from India. Dr. Goel has been inducted in American Society of Ophthalmic Plastic Reconstructive Surgery. She is the only oculoplastic surgeon in India to be trained by world-renowned celebrity dermatologist Dr. Jayan Obagi. She is the only Indian doctor to be trained by leading doctors in the US under the long-term fellowship in the University of Wisconsin, started by Dr. Dotback, godfather of oculoplasty in the world. She specializes in droopy brows, droopy lids, baggy lids, eye bags, Asian eyelids, entropion, ectropion, xanthelasma, and non-surgical blepharoplasty. She is the founding partner and executive director of Foresight Limited, and also she is the section editor in the facial aesthetics group in Indian Journal of Ophthalmology, May 2017 till date. She is also the faculty and consultant medical aesthetics Asia Pacific Allergen Academy October 2015 till date. She received several awards, to say few, chosen as top 10 women surgeons in India by Women Entrepreneur Magazine 2021. Jayavan Shah Gold Medal for the Best Outgoing Fellow of the Anterior Segment at Sankanatha 2007. And Dr. Venkat Swamy Gold Medal at All India level in National Board of Exams for Postgraduates 2005. She has 14 teaching appointments and 10 past projects. They are the few I have selected from her long biodata. I welcome you, madam, today's program, and I think you will be giving us a very good lecture about this oculoplastic aesthetics. Today's moderator is Dr. Rajesh Chaudhary. He is the currently senior consultant ophthalmologist at Netralayam, the Super Specialty Eye Care Center, Mukundapur, West Bengal. And today's panelist, Dr. Sarvishta Behra, Professor Bimsar Burla, Odisha, Dr. Ruma Das, Professor HOD, Silchar Medical College and Hospital, Assam, Professor Chandana Chakrabarti, Professor HOD, National Medical College, Kolkata, Dr. Meer Mishra, Consultant MGM Eye Hospital, Raipur, and Dr. Malay Burma, currently in practice as an oculoplasty specialist in Ranchi. He is from Sankanatha, Chennai. And today we got a very big group of postgraduate students who are very much interested, and they said their names to be participate in this program. Dr. Lipsa Mahapatra from Bimsar Burla, Dr. Bharat Mittal from HIMS Lucknow, Dr. Anita Sankla, AIMS Patna, Dr. Nistha Misra, AIMS Ranchi, Dr. Jai Dakshini from Ruby Eye Hospital, Dr. Juhi Gupta from RIA Kolkata, Dr. Piyush Jain and Dr. Manasa from MKC Medical College, Berhampur, Ranjini Agrawala from Dibrugarh, Assam, and Dr. Abhiniti Siddharth from LBP Bhubaneswar. Sometimes we go beyond the EIZOC boundaries and invite the students from the other parts of the institution, from other parts of the country. So with these few words, I welcome you all once again to today's program of True ORTS 23. Thank you all for joining. Now it's over to Dr. Subra Goel to start the program. And Dr. Rajesh has joined, our moderator. Have you joined? So few comments from our mentor, Dr. 2 minutes, because today Dr. our CS is missing, Dr. Secretary is missing, so you can say a few words on behalf of them.
No problem. I think we know Subra very well, and I think she will do a great job. Let us listen to her. Subra?
Yes, sir.
We can continue.
Okay, thank you, first of all, for this kind and warm invitation and a very beautiful introduction. I think it's always an honor, pleasure to be in groups where postgraduate students are interested to know what's happening in the field of oculofacial plastic surgery, and I will be focusing more on aesthetics. Thank you, sir, for inviting me for this. When I say sir, Dr. Ajit Babu, I mean, we have long association from Center for Sight, and it's always very, very special when you invite us. Malay is on board and Rajesh is on board. I hope they're there, so I know them well. They are my friends and colleagues, so I'm hoping to interact with them as well. Okay, so without further ado, I'm going to start my presentation. And as you see, the first slide itself tells you a lot. So there's always something which is behind the mask, right? And as ophthalmologists, so we fail to see or remove that mask, and we focus on to very specific things as practitioners because we are taught that way to have that vision located to our or specified to our specialty. Before I start, I think my affiliations have been told, but I always do pranam to my mentors because without them, without my alma mater, I won't be here. And I've been very, very lucky to be trained by some of the best people in the world, and I owe everything to them when I present here. I don't believe only in work. I feel there has to be a perfect balance in work and pleasures of life. So beyond what I do, which is aesthetics, which is my passion, I'm a Shih Tzu mom. I have 2 Shih Tzu babies. They're my babies, Alu and Tiki. I'm a vegan athlete and I promote veganism as a lifestyle. I do a lot of interior designing and I'm also a traveler. I love to travel the world because I think once you travel, you learn a lot about yourself and others. Now, when you look at the aesthetics is everywhere, okay? So these are some glimpses and pictures from my house, which I've decorated, my babies, even they are plated and they're looking cute. And this was the cake I designed for my husband on his 50th Rashmin. This was a fountain of progress and love, which I designed for him. So what I'm trying to say is that you don't get older, you get better. And this was the tagline I gave to him. And that's what I believe in, that I think aging has been over exaggerated when it comes to especially the Indian subcontinent. There's nothing called aging. You just get better, I think, like an old wine. And at the same time, aging is an inevitable process. It's a fact of life, but looking your age is not. It's in our hands how we want to look. So we are going to age, we all age, that's inevitable, but how you want to look, what you want to present, the way you are is absolutely in your hands. So this is one of my favorite pics. If you have attended my previous conferences, you may have seen this before. So this is me here and my sister. What I'm trying to show is that you always study your own face when you want to study the aging process. And I'm going to take you over that a little later. So when we are born and we are young, we have oval face, we have good fat in our cheeks, and we look kind of nice and full. But as we start aging, the oval face starts becoming squarish, we get lines, we get furrows, our skin texture changes, and that's where we want to bring the change in the face back. So in the audience, if I had the live audience, I would ask, which is healthier? So everybody would pick up as, the raisins are healthier, but they don't look as beautiful as grapes, right? So there is a fine balance between when we do aesthetics practice, because a lot has been spoken about aesthetic in the market and there are goods and bads happening. We need to optimize our work when we do, where we have to maintain the health as well as the look when we are giving the results to our patients. As I was just being introduced, I saw this very beautiful picture somebody shared on WhatsApp. So you see there's something artistic about it. And when you zoom it, it's just the formation by the kids which they have done. I mean, that's what facial aesthetics is all about. It's just those minute details which you present as a package and you give an overall, change to the personality or the emotional quotient of the patient. So when the patients come to us, we don't talk about specifics. We don't talk about lines or bags or dark circles or, anything. We just talk about emotion. We talk about how they feel they are, what is making them feel awkward about themselves. So some of the leading questions I ask is, instead of asking them, how old are you? I always ask, how young are you? And how old do you feel? So we change and twist the question. So if you ask me how young I am, I'm 48, but how old do I feel? Maybe 25, right? So this is how we play around with the emotion of a patient. And what is that you consider you look the best, you want to feel the best. So we're trying to emote that, bring that out from the patient, okay? So this was just random pictures which I had taken. I think I was recovering from my surgery, so pardon me for very raw pictures. So this is an animated picture. I thought, okay, now that I have been not exercising, I've not been taking good diet, let me see how I'm aging. And if you see, when you go towards the gravity, you see more aging being shown versus when you're against the gravity, right? And the emotions change, the dynamicity of your face change. And this is one of the raw picture of mine without makeup, without anything done. So this is how you can test on yourself how we are looking. Always remember, these are the P's which I always practice and preach, that patient comes on the top list, practice is the last thing, and in between somewhere is everything else. So when I say patient is your top priority, you have to always look at the interest of the patient, what they want. You also have to have your practice patterns, whether it's your technique, your credentials, or your ethics in these two ends. And in between comes the procedures, the protocols, and the most important thing in aesthetic practice is patience. We cannot see 100 patients a day. We cannot do 25 cataracts a day. So we have to do one bleph a day, for example, in a private practice. So we need to have a lot of patience with these clients because we are dealing with an emotion. Any patient you pick up. So I'm going to change the thought process here as we were discussing, that it's not about only celebrities or vanities or pastry personalities or glamour. No, it's about a common man, a common woman, a person who walks into your clinic, right? Everybody needs something. So if you look at this girl, she has acne, she has tear trough, like hollowness below her eyelids, and she is just 20s, in her 20s. So if I look at her face, her emotional quotient is she's looking tired. Her skin is not looking good. So there's something I can offer to her, right? Something which can be offered to make her look a better version of hers. Now, unfortunately, this is me. This was in 2010 when I came back from US, and I had forgotten how I looked. I never thought I looked like this. And one day I was standing in the mirror and I was like, oh my God, what have I done to myself? So I had put on weight. I was not taking care of my skin, hair, whatever. I was just like a workaholic zombie working in SN. And that is where I changed myself and brought myself to the present version. Have I done anything drastic? No. It's all about lifestyle and doing the right treatments which are required. Have I done too many treatments? No. But you can transform yourself as a better version of yourself. So you see, what has happened with me myself is that the emotional quotient on my face has changed. I was looking dull, tired, angry, sad, pigmented, and I look a fresher and a better version of whatever it is as you see today and live in the screen. So there are pillars of core aesthetic practice. We divide them into surgical, non-surgical, and allied. Allied also forms a major part of our practice patterns today, which is very, very important because market is very dynamic and there's different kinds of procedures. Now, when I talk about oculoplasty or oculofacial aesthetics, I beg to differ from the population that I want to learn aesthetics, I want to learn aesthetics, I want to do this, I want to do that. No. So anybody who comes to me and say, ma'am, I want to learn aesthetics, they have to go to the grinding of learning the basics because oculoplasty itself is aesthetics. So what you're doing in the general oculoplasty surgery is nothing but aesthetics because you are transforming not only the structure, but also the shape and the emotion of the patient. Whether the patient has thyroid eye disease or ptosis or eye bags or ulcers or lag of thymus or anything, you name it. And I'll share some of the examples here. See, for example, now this patient has a cicatricial ectropion. Okay, so I mean, for us as general practitioners or a general oculoplasty surgeon, cicatricial ectropion, treated, patient's eye is not closing, watering, blah, blah, blah. But it is also a cosmetic blemish for a patient, In addition to the functional aspect of it, there is a cosmetic blemish. So any case which walks into us, or at least for me as an individual, and I'm sure my colleagues would agree with that, is a potential aesthetic patient. Now, whether we do it surgically, non-surgically, or with other practice patterns. Okay, another example, facial nerve paralysis, patient had lag of thymus, you can do conjunctival congestion, corneal ulcer. We did a facelift. I didn't do any kind of other procedures. There was a gold implantation which was done elsewhere. We did a mid facelift and you can see the facial, the whole eye expression and the facial expression is also changed in addition to the functional benefit which we have given to the patient. Scars, again, form a very important aspect of our practice pattern. So these are just the examples which I'm giving you before I take you to the specific so-called market-oriented aesthetic procedures, okay? This is a patient with canalicular injury. You see there is a webbing of the medial canthus, and this is without it. So what we did a lacrimal gland Botox, because we cannot do any surgery in this patient. Now Botox, to name it as an aesthetic product, but we use it for functional things, but it also gives a cosmetic benefit to the patient, because a watery eye is not a good looking eye. Patient is not comfortable with that. Of course, there are other examples like, socket surgeries. I'm not going to take you into that. Of course, trauma itself is very, very important. Ocular oncology, where we do the excisions and reconstructions. Again, case of trauma, we have reconstructed involutional entropions, congenital entropions, contracted socket, the canthal deformities. Again, a case of facial nerve paralysis, a patient who had a sclerosing orbital disease. We did a heart palate graft. Orbital tumors, where again we are dealing with not only the disease but also the the treatment patterns. Of course, ptosis forms an important part, but I'm not going to focus my talk on ptosis today. We have different forms of ptosis surgery, just for the knowledge of postgraduate students, that we can do it with levators and internal molars, dissections, sling surgeries, frontalis flaps, and so on and so forth. Now look at here also when I'm showing these pictures, yes, we are correcting blepharoptosis or ptosis, but look how the emotion and expression of a patient has changed from a sleepy, sad to a wide awake individual. We have not done any vanity treatment for the patient. Okay, so patients who are walking unto us are the collateral, the collateral specimens for us, sorry for that word. But if suppose a patient comes to me for ptosis surgery, now look at his skin. He becomes a patient for me for skin treatment. If this is the patient, second patient comes to me for ptosis surgery, look at, there is a scar here. I can always treat that scar. So if one patient can have multiple problems and one patient can feed another disease process in himself or herself for us. These are asymmetrical eyelids, which we have corrected. Very, very mild ptosis, which has been corrected. And here comes the BAP of all, which is the blepharoplasty, which we do, but I'm going to take you through that little later. So eye bags is a very, very common condition which comes to us, yet missed and mistreated by a lot of people in the industry, because people don't care. They don't bother. They say we want to age gracefully. But according to me, this is not aging gracefully. You need to remove the bags, because not only they don't look good, they change your emotion. And I mean, they're not nice. I mean, we have to remove them. I mean, there's no other way to it. So anybody who has bags, you know where to refer them. So eye bags is corrected by blepharoplasty. We can do from the skin side or conjunctival side. I'm not going to go into the technicalities of every surgery today, because it's an overview of what I'm presenting. Yeah, so this is the patient after the surgery. If you see now, what I want you to focus is not the result per se, but the emotion and the age factor which has changed in the patient. So the patient is same. We haven't converted him into a 25 or a 30-year-old looking man, but we have converted his expression as a fresher version of himself. He's looking nice. He's looking fresh. So that's the main idea. This individual had both upper and lower eye bags, and this is how he looks once the lower bags has been. And I don't think he was interested in the upper eyelid. I did it. So we did the upper and the lower. So look at the picture. He also has a pre-existing ptosis. We have not touched the ptosis because patient is not interested in that. But if you look at, we have not changed the structure. We have not created a new eyelid for him. He's still the same. There is still some laxity. So we are trying to give a natural result, as natural as possible, changing the features a bit, because the more natural you stay, the more minimalistic you stay, that's the best result which you can give in the aesthetic practice. Okay. So this is another girl. This was only after 1 week, because you can still see the scar and pigmentation where we did the skin excision and the fat reduction. This is another patient. So he has what we call as a hill and valley effect, where there are some bags and some depression. An ideal candidate for fillers, but we can also undertake surgery, because we go by what the patient actually wants. So this patient was not interested in having any kind of injectable technique. So we went ahead and did a transconjunctival approach for his removal of bags. Now, is it Asian blepharoplasties, I mean, in your part of the world, that's why I said I like East, because it's like the diamond mine for it. And people are so aesthetically oriented. They agree for procedures very fast. They know what they want. So this was one of the cases where you see there was just a no fold of skin on it. He had a little bit of an Asian look or Eastern Indian looking look. I'll not call it Asian. And we just kind of played around with his lid crease reformation and little bit of skin to change his expressions. These are very classical, Asian lids where, again, I want to bring to your notice that we are not converting them into classical looking Caucasian looks or the down south look. We are still maintaining their ethnicity and just kind of fine tuning and giving a soft surgery treatments. This is, I think, one of the cases which I did in Center for Sight only when I joined there. So this lady had
Recording stopped.
This patient had very heavy forehead. If you see, the brows have completely dropped down. She has entropion and she has a lot of frowning happening on her forehead. So we went ahead and did a mid-forehead lift. We did entropion correction. And after that, we did a little bit of Botox on her forehead. And this is how she looked after her procedure. Some patients just walk into us and they don't know what's wrong with them. For example, in this lady, if you see, the scleral show is a little different. And we went, so there is an inferior scleral show. So we went ahead and did a retractor recession to bring it up, to kind of make her eyes look a little smaller, which were looking wider. And this is how she looks now. Okay. Depressed scars, these are some of the conditions which can be treated non-surgically, where we can do the fat transfer or fillers. I prefer fat transfer in these patients because autologous graft is always better in depressed scars. So this was a patient after the fat transfer. Now this patient had a lacrimal gland tumor. She was operated at least thrice. So, but she didn't like the scar afterwards, you know. So what I'm trying to bring your notice here is, when we are in our practice, we are not treating only pastry and celebrities. We are treating normal individuals with normal conditions which have to be treated like an aesthetic problem. Okay, in ophthalmic sockets, where the eye is a non-seeing eye, either we remove the eye and put an implant, which is a traditional way of doing, or we can even go retrobulbar fat transfer and retrobulbar fillers to bring the eye forward without disturbing the structure of the eye, provided it's not a painful eye. But if it's a painful blind eye, of course, surgery is a first preference. When some individuals, it's not needed and we can get very, very good results. So this is another example where we did the dermal filler and the contact lens to bring the eye in position, and we did a retrobulbar filler for him. Now, coming to very specifics, which all of us will get into our practices, apart from upper lid blepharoplasty, lower lid blepharoplasty, which is the hooding of eyes or bags, is dark circles. I think every cataract surgeon who is here in the audience would agree to me that the moment you do LASIK surgery and the glasses are out, patient will come and complain and say, oh, my eyes are looking different. I'm looking a little different, because they have never seen their eyes behind the glasses, you know. So there will be dark circles, there will be a tear trough deformities and so on. Festoons, I will come to it just to touch upon. Xanthelasma, I want to bring to your notice because I have been doing a lot of work in xanthelasma of late with the new technology, and I have got very good series now. We presented in American Academy, and it has been very, very well appreciated globally. I've traveled almost 10 countries to present my work, and it has been very well appreciated. So I'll kind of give you an insight on that. And what is new in the industry and what are the combination therapies which we are doing? So dark circles, 10% of the world population suffers from it. India has a similar problem. The myths are that people think lack of sleep, excessive crying on long hours on computers is the cause of dark circles, when it is not, right? So this is a myth. Dark circles are not because of excessive crying, lack of sleep, long hours on computer. It just exacerbates the pre-existing dark circles. The facts are dark circles can be hereditary or congenital. They can have a bony framework disorders, which cause the sunkenness of the eyes. The skin texture may be different, vascularity, pigmentation, and shadow effect. So these are different reasons why the dark circles happen, and there are ways to treat it. So it's not as simple as it looks to be. So people with dark circles usually will have a lot of, low morality with them. They feel very sad about it because people point out to them that they're looking tired, groggy, sleepy. In addition to the cosmetic blemish or under eye hollows, the first three, which is tired, groggy, and sleepy, is the complaint which patient will give it to us. So again, we are talking about the emotion. We're talking about emotion, which is connected to a disease process. So there are various treatment process. Everybody has to have a tailored approach. There's not one tool which fits for all. They can be complex treatments. So options are injectables, surgeries, lasers, cosmeceuticals, IV infusions, lifestyle changes, and so on. So when patient comes to me for dark circle, my consultation is actually for an hour, and they're given a treatment calendar for a year of what all they can do, what all can be done for them, and then they choose from what they can and they're interested in. So there's few examples. You see, there's a very deep pigmentation for this lady, grade 4. It's impossible to correct this kind of pigmentation no matter what kind of treatment we do, but we can reduce it to an extent. So this lady had under eye fillers and some amount of cosmeceuticals. So I would say from grade 4, she has come to now grade 2, which is good because we cannot eradicate dark circles. This is a very classical case where I'm saying the inferior hollows. She had a LASIK surgery, and this is what we have filled up after the procedure, after doing the under eye filler. So this is how we can take care of it. A word on festoons or malamounts. Now, a lot of patients are referred to us for blepharoplasty when actually it is not the case of blepharoplasty. Now, look at this individual. He has a lot of skin laxity. There are a little bit of eye bags. So this is a case where I would like to do upper lid skin, lower lid skin, and fat pad removal and give him that rejuvenated look versus this lady who has a lot of bags and, on the cheek area. Is my cursor being seen there? I don't know. But, she has, she has this area where, there is a collection of the fluid. That's a lymphatic fluid that is malar mound. So there is a difference between a malar mound and the lower lid bags. And it kind of looks like a garland. Festoon is nothing but a garland. The meaning of festoon is a garland. This is my mother. So she has a combination of upper lid dermatochalasis, lower lid dermatochalasis, and festoons. And see, when I did her surgery, this is day 3, how much of malar edema has come in. Okay, so this is something which happens in individuals with heavy faces, lymphatic block, weaknesses, who have thyroid patients, renal diseases, and so on. So malar mounds are not so easy to correct as it looks to be. Again, a classical example of lid laxity, bags, and malar mounds with pigmentation. So very complex cases which we have to deal stepwise and give our treatments. This was one of the, again, a trial which I did with my holistic healer. We said, okay, modern science has no result for malar mounds. Let's try and do acupuncture. And this is what we got for her after 8 treatments in 90 days. And this is me after acupuncture, getting rid of my malar mounds. Okay, thankfully, it has not come back to me. So there are different modalities which can be combined, not only in the modern science, but we can work with our alternative medicine people also, provided we understand the science behind it. And I'm a firm believer of that. Now, coming to plasma or the soft surgery, this will be very new for many of you who are in the gathering. This is a tool which is from GMV Italy. It was launched in the world in 2001-2. It started because they wanted to do a non-surgical blepharoplasty, and it's called the soft periocular surgery. But now the indications have gone beyond. It has gone beyond periocular surgery. How it works is it produces the plasma energy. Now, plasma is the 4th state of matter. So if you look at this picture here, this is the tip and the tissue, and you see the plasma is being produced between the two. So we don't touch the tissue, we submillate the tissue. So there is no collateral damage happening. There is no cutting or coagulation happening. We are submillating or evaporating the tissue to form the collagen or remodeling. And it is doing wonders in my clinic where why the video is not running, I don't know. But yeah, so this is an example where we can deal with the laxity of the skin, which is a non-surgical blepharoplasty. And yeah. You can see the video, right? I'm performing the periocular wrinkles. So instead of giving Botox, we can actually do plasma therapy now for patients. Patient may need 1 or 2 sessions, 1 month apart, or sometimes 3 sessions. What it is doing is we are not burning the skin, we are not damaging the skin, we are forming the collagen along with other treatments like, cosmeceuticals or something. So as I said, the indications have gone beyond aesthetics or periocular surgery. It is very, very important tool in ophthalmology today. We can do chalazions, we can do pterygiums, we can do conjunctivochalasis, And we're doing Dr. Fahad from Iran is doing phenomenal work in ophthalmology with plexer, gynecology, dentistry, and so on. So we can always have more discussion on that if the area or the interest is right. So this is one of the first patients I did with plasma for periocular lid laxity. If you see the pre and post, the wrinkles have gone down, the laxity has gone down. It doesn't seem like anything has been done, and patient didn't do any Botox treatment. Okay. As I was saying, xanthelasma, I think this has become my favorite indication for plasma, and I'm getting phenomenal results because xanthelasma is one condition where there's no treatment in the industry, whether you have lasers or, surgical excisions, they recur. So the reports have said, the scientific literature, I did a review, and it has been found that all the modalities have at least up to 20% chances of recurrence or post-inflammatory hyperpigmentation. But with plasma, we are getting 100% results. The patients who have grade 1, grade 2 xanthelasma, there is 100% correction. If they're hypertrophic plasma, grade 3, grade 4, we may have a hypopigmented scar, but not an hyperpigmented scar. And the recurrence rate is 0.01. So this is one of the cases which was very difficult for me. This is grade 4. This is after 4 cycles. The patient looks like this in present. But if you look at the patient from, this is very magnified image, distance, you will not come to know that the patient had xanthelasmas. And we have tried in all skin types, all ethnicities, and we have got very, very good results. So this was the initial experience which I presented last year in the academy. And we have been able to show that there are no recurrences and there is no post-inflammatory hyperpigmentation, and the satisfaction score was 9 out of 10. Only one patient was not happy because of the hyperpigmented scars. Okay. Plasma has other indications. Now look at here. This is a sebaceous cyst subbrow, and I have just done plasma. I have not used any blade, any cautery. I did a non-surgical excision. So you just enter with the plasma, you submillate the whole tissue, use your Wattman's forceps and just remove the capsule out. She's a doctor and she was extremely happy because she didn't have any downtime. We can do larger cysts now. I have gotten away from surgeries or radiofrequency cauteries. I'm using more of plexer. As I said, pinguiculas and pterygioms I'm treating if patient lands up into my OPD, of course. We are doing hemangiomas with it. We are treating scars. If you can see, the scar remodulation is very, very good, but it also depends on the patient's, compliance. This was one of the DCR surgery with the scar was very, very bad, hypertrophic pigment, and this is after 3 cycles of plasma and some scar treatment management. Injury patient who came to us and we started doing his scar management and plasma, and this is a 6 months old picture. Latest picture is not with me right now, but he looks much better. Of course, it is used in all kinds of skin lesions like seborrheic keratosis, molluscums, warts, even freckles. All these things can be taken off with plasma. This is just one sitting of plasma, and she didn't need anything. There are no hypo or hyperpigmented patches on her face. There's another doctor from Apollo, and he had a lot of these solar keratosis and hyperpigmented stuff, and we just removed it in 1 cycle for him, and he was happy. Syringomas, very, very common in Indian population. Again, no treatment available. People don't know what to do because there are recurrences. I have 3 cases, and all of them are doing well. Of course, patient has to come regularly and also have other treatment modalities with it. I also tried my hand with cyst of mole, and in just 1 tick, I was able to take it out. So as I said, I'm not using radiofrequency or surgical modalities. This was a benign tumor, and you see here, it is gone because I've just evaporated the lesion. I've not even cut it, right? So this also gave me a very good result. Nevises, otherwise, we used to shave off the nevis with radiofrequency. Now I have just submillated it, and patient is extremely happy. So why it is very, very good tool is because there is an immediate contraction of the collagen fibers alongside the newer formation. There is no residual contraction or collateral damage, as I said. Other treatments you can look here that we have done for the patient is that we combine the treatment modalities. So now she has lower lid bags, and she also developed she had a lot of these keratosis happening. So we dealt with her skin. We gave her some skin treatments. We did her under eye hollows little bit and did a blepharoplasty to give her the result. Upper lid hooding, another very, very common. So we did an upper lid blepharoplasty with an internal brow lift, and this is the patient. The scar is still healing. I think it was 1 week old after the surgery. After that, patient never came back. So I feel that no news is a good news. We can transform the patient completely. And these are not photoshopped pictures. These are real pictures where we work on the patient, we sit the patient, and we kind of change their complete look in terms of their brow positions, eyelid positions, how their lashes would look, how their smile will look. And we kind of work on them and give them that facial symmetry and the oval shape to give that transformation. Okay. Another case where I should have put this slide a little earlier, but this again becomes a cosmetic treatment because this is an orbital fat prolapse, and this guy is 90 years old, but he still wants that. So we do it for them because they get troubled by that presence. Doc, I read a lot, but when I look in the mirror, I don't like this. So we had to remove it for it. My mother, this is how she looks now. She is a hypothyroid patient with a lot of other disease processes, but I could give her this look, which looks pretty decent. And of course, we can play around with injectables, which is Botox, fillers, skin treatments. We can reshape the lower face. We can give a new look to the whole face. We can make the face look slimmer, from more squarish to more oval and slimmer. We can play around with fillers and Botox to even work on eyes which are blind. If you look at this patient, she has an eyebrow going up with a prosthetic shell, and we can bring it together. So I've not done any surgery, but played around with only Botox and fillers to give her that symmetry. We can reshape the lips. We can give some shape to the lips. We can do elongation of the chin, which gives an oval shape to the chin. We can transform the complete face from square to non-squarish face, and we can give a transformating feature change to the patient. The new other treatments are threads. I don't use them too often, but they are in the industry, and it's very, very easy to use, where you can do the brow lift, you can do the cheek lift, you can do the neck lift. As I said, I'm not a big fan of it, but it's good to have in your kitty to understand how you want to do it. Okay. So this is how the procedure is done. We are here trying to lift the cheek for the patient. We go into the pre-smash level and just put the thread in and pull it out. Okay. So this was one patient who wanted shallow nasolabial folds, and we did a thread for her, and you can see the folds have kind of settled. This is just a thread which has been put and nothing else. This patient, we transformed the complete face. So look at the, more definition. She's still squarish, but her eyebrows are better. Her face tightness is better, but it works the best in patients who have slimmer faces, not on the square face. So look at this girl. I mean, she has got such a beautiful definition after the facelifts. After the threads. We have not done any kind of fillers or Botox. Skin treatment is very, very important. In addition to all the surgical procedures we do, whether it is blepharoplasty, brow lifts, and so on. Because if you don't have a good skin, you're not going to look good at all, because skin is the mirror to your face, as the eyes are window to your to your soul. Skin is the window to your health, to your beauty, to everything. As surgeons, we usually forget about skin treatments. This is the range which I use. Dr. Zain Obaji, I was very lucky to get trained by him, and I use these whole product range. They're very, very premium products, but they give very good results. So these are some of the patient. Now, these are again not Photoshop pictures. These are real textural changes which happen in patients when they are compliant for the treatment and they use it on regular basis. So here we have done some Botox filler to make her face elongated and with the skin texture changes. Another word on skin hydration fillers. So this I tried on myself to see how it works. And I've done quite a bit of neck laxating fillers for myself to see how it works. And it works nice. Okay. So skin hydration fillers are nothing but because as we age, the collagen depletes on our faces, on our skin. So we have to rebuild it. And one of the good ways, apart from your lifestyle, oral supplements, or the cosmeceuticals, is the skin hydration fillers. So as I said, these are just the overview I'm giving because each topic has its own, debate on it. Now, this is me with very, very, very scanty eyebrows and lashes. And this is me after the treatment with beautiful lashes and eyebrows, okay? So we have tools for everything. Why am I showing my own pictures? Is because that's the most authentic way to tell that these things work. And we are not celebrities. We are not getting into any movie or anything. We are just normal individuals who just want to maintain. Micropigmentation is on high nowadays. A lot of people are getting into it. So it's good to have in your clinic if patients are demanding. Otherwise, just leave it. It's very good to collaborate with your cosmetologist or dermatologist friends to have all the kinds of machines to offer to your patients. If you have the bandwidth and the stamina, you can have machines in your clinics and offer, for example, CO2 lasers, HIFUs, which is skin tightening treatments, non-surgical facelifts, body contouring machines, laser tonings for the faces, laser hair removal, all that. Now, as an oculoplasty surgeon or an ophthalmologist group, somebody would ask me, why we should venture into it? It's not like this. The thing is, you have to give an holistic treatment to your client when they walk in. You cannot tell them that I cannot do this, because today's market is dynamic, it is competitive, and you cannot practice oculofacial aesthetics in ophthalmology. You cannot. If you look at from an ophthalmologist point of view, will never be able to practice. So the word to all the youngsters is, please go out and see what's happening in the world. You have to collaborate with your colleagues. Choose your colleagues well, and you can collaborate or have your own tools and machines, because nobody is going to stop you from doing that, because as an MBBS doctor, you can practice that. I believe a lot in nutrition and lifestyle, because I have gone through my own setbacks in health. And I feel that unless you collaborate with a good nutritionist for your patients, you're not internally changing anything. So your internal environment also has to change to give an external change. So I may do 100 treatments, I may do beautiful skin cares, but if I'm not changing the the internal environment of my body, that is not going to reflect on my face or on my on my health. So we are also into IV drips now. We are giving all kinds of IV drips, which are a combination of amino acids, vitamin C's, glutathiones. There are different fancy names to it, but the idea is that you want to put and give a bolus of what is needed for the patient. And believe me, it's a very hot seller, because people do see changes, people do feel good about it, and it gives very, very good results in addition to whatever treatments you're doing. So in the end, I will just say that this is just the beginning. I've just given an overview, tip of the iceberg. I may not have covered certain areas like brow plasties and this and that. I just kind of showed what's happening to give an idea to the younger generation and also the other colleagues who are there, is that we need to expand our vision. There's lots to achieve. Training is an ongoing process. You have to keep learning. You have to keep collaborating. You have to keep teaching and training, because unless your training is solid, unless you collaborate, unless you travel, you're not going to know what's happening in the world. And you need to keep yourself updated with various technologies and modalities which is happening. This is my office, that's my temple where I sit and do all my work, Clinica Phi. And a word on Clinica Phi, Phi comes from Fibonacci, which is the golden ratio. So that's a Fibonacci sequence. So all of us have golden ratio. So we are just trying to restore that golden ratio back in terms of whatever procedure we are trying to do. So I'll just rest my talk here, and I'll open the forum for questions and, anything which is needed. So I hope I could give an overview of what we are doing in the industry today. Thank you.
Yeah, thank you, Dr. Subra. That was a wonderful overview. We really we were really mesmerized by the concept that you showed, because we are basically surgeons and not into aesthetics. We only think about cataract, glaucoma, this, retina, and this and that. So this field basically is not the field that all of us have an insight into. So the best thing which I could find out from your presentation was the plasma therapy. I mean, that was basically new and a kind of a non-invasive. So can you throw more light on the plasma therapy, because that looks like a good tool, and what is the price of that plasma unit that you use?
Yeah, before that, I would remember Shushruta, who's been seen in Dr. Sharmishta's background, because he was
And then I'll hand it over further discussions to the panelists if the moderator.
Yeah, so I always bow down to Shushruta because he's the father of everything for us as plastic surgeons and as ophthalmologists. So let's bow down to him. And thank you, ma'am, for having that picture. In fact, I had a paper on Shushruta when I was doing my fellowship. It was very fascinating to go through Shushruta Samhita, that how much work has been done. Coming to plasma, the machine is by GMV Italy. There are a lot of other machines which are from Korea and China, which are the replicas of it. This is the patented one, FDA approved. So a lot of people go for the cheaper versions, but I believe in the original technology is always the best. So the cost of this machine, it's better if we talk offline rather than being online. As I showed that the indications as ophthalmologists and as oculoplasty surgeons are immense. You can do full face rejuvenation, you can do non-surgical blepharoplasty, you can correct the wrinkles, you can remove all kinds of lesions, which I showed some of them, xanthelasmas. Inside there, you can do instead of using punctal plugs and punctal cautery, you can actually do plasma to block your puncta, you can do pinguiculars, you can do pterygiums, chalazion, conjunctivocalycis. What else? You can even do the trab, the flaps which are made. There are papers on that. I mean, of course, I'm not an expert on that. So there are various indications people are using for scars. I showed some of my patients with scars, and extended uses are in dentistry, even stretch marks after pregnancy. Very good results are coming. So there is wide range of indications for it, and we also have plasma facials. Little off track from the discussion we are doing, but it has a tip where you can do an exfoliation and then you can put vitamin C, hyaluronic acid, and kind of gives that glow to the patient. So one machine does everything. I have reduced my use of radiofrequency cautery in the OPD to 0% now after plasma, because I'm very happy with this tool. And I'm the first one in India to have it, which is also nice to be because I always get fascinated with the technology which is new.
Can I request Dr. Shamishta Behra to take over the discussion part and take every panelist into the fold of discussion? Dr. Shamishta, ma'am.
But I'm so spellbound with her aesthetic talk as well as her aesthesis that she's described. I'm spellbound. I do not know what to say. I would request Dr. Mihir to please convene.
Sweet.
Yeah, it's fantastic talk, and also whatever patients she has shown, like those are very happy patients. They've come with a gloomy face, and also that she acts as a healer. And the patient comes as a patient, but actually we should work as a healer, like both the psychological part and also the anatomical and the physiological defects has to be taken care of. So that is a comprehensive type of healer package which we as a surgeon or as an individual or as a treating physician, we should always try on that. And regarding the latest technologies which has come through in aesthetics, I think that is unlimited. So we are still on the way with a lot more coming, mostly the lasers and the plasma therapies in varied stages, in varied type of disease process also, even the superficial surface and also the deeper lesions. That also works out very well. Of course, because the skin's composition is varying from each person, so we have to be very vigilant and we have to see like is it compatible for that particular person. So that also comes with the experience and the skin texture or the composition which we see over a period of time with the racial differences within the different regions. So accordingly, we can just tweak it and try to get the best of the results. And of course, demand is another thing. We sit at a place where the demand may not be that much. We can create a demand. So there may not be demand or people are not thinking about it. Regarding that, the aesthetic part is very important. So what we can do is we can create an environment for them. We can show them that you can be transformed. So that way we'll get a better.
Yeah, I
results.
always show my pre and post to sell
Absolutely.
it.
We have to
Because
see
that's the
our own
best.
people, like,
Because people don't believe otherwise that it works.
yes, that's why I say in our hospital, so whenever patient comes and say that how do we the results? So we saw our own staff which we have worked on.
Correct.
So they give their own experiences, and that gives them more like confidence in the patient that yes, we also will get a better results.
Yeah,
So
I think
that is the best way to go.
adding on to your Dr. Mihir, you've touched a very beautiful point of being a healer,
Yes.
because
Yes.
we are not treating sick patients. We are
Yeah.
treating healthy patients. So when
Yes.
you treat a healthy individual, that ball game completely shifts. The way you talk to the patient, I don't even call them patient. I call them my clients or friends or family, because all of them become
Right.
family and friends at the end of it. Because what they want is the functional or the structural deformity which they have is one thing, but the emotion and the morality which they are carrying with it is another thing. So 99% of people just need a listening ear.
Yes.
So you need to be a good listener and counsel them in a very beautiful way. And the second thing I think I would touch here is that there's a lot of negativity and negative propaganda going on about the aesthetics and cosmetic industry. See, every field and specialty has two paradigms, the extremes. And as I showed the first slide, we need to be in the optimum stage. So if you are well trained and you have an ethical practice, you can never give wrong results to your patients. And I think the patients also have to be taught and told that, don't go to untrained doctors, go choose your specialist well. And I think the ownership lies on our shoulders as a fraternity to promote and talk about it more and more and get out of that constipated overview. So whenever I talk to an ophthalmologist group, I get a little irritated because I was like, don't look at only cataract, don't look at only glaucoma. You're looking at the eye, you're looking here, your patient is putting the eye on the slit lamp. Please look there, because there is anthelisma, there is dark circle, there is eye bag, there is skin. And because as ophthalmologists, we can actually treat the patients around the eyes the best. Whether you're oculoplasty trained or not comes secondary. At least you can catch hold of that disease and refer. And second point, I think in aesthetics, what I have learned from my experience, I'm sorry I'm taking away that discussion point, is that you need to collaborate. A lot of youngsters come to me and say, ma'am, we want to learn aesthetics. No, you cannot learn aesthetics because blepharoplasty is not aesthetics. Botox is not aesthetics. Aesthetics is the holistic approach to the patient. You need to collaborate with plastic surgeons, with dermatologists in a very healthy way and give a complete treatment protocol to the patient. And whether you want to do it is a separate thing, but you need to have everything under the umbrella which a patient is asking today in the industry.
Yeah, it should be a comprehensive package because it's not for one time, it is a lifetime which you are in the treatment process. And you have to understand, like basically you have to make the patient understand like what realistic expectation he should also have regarding the treatment, and also like what we can deliver them over a period of time. Even the nutrition comes into act, the exercises and the lifestyle also comes into act whenever you're getting a result of it. So everything combined, you get the best result. So it's not just the cosmetic thing or the therapy which you are doing that will work out. So even the other parts does play a role in this, mostly the aesthetic part, which helps in making us much better look as compared to.
इसका solution है कि
The other part which I think it is
long distance
dealt
में
with is
जाता है
Botox
आदमी
and
फिर
fillers, of
धीरे-धीरे
course.
चीजें खत्म होंगी.
I think somebody is.
तुम भी नहीं जा पाओगे.
Bharat Mittal.
Can you mute yourself?
But
If the postgraduates have any questions, they can ask.
yeah,
Piyush?
postgraduates, they can ask about like Botox fillers. Those are the common things which they encounter basically.
Dr. Piyush is visible with the video. Dr. Piyush, go ahead, please. Unmute and go ahead.
Let them ask Piyush. Yeah.
Yeah, I'm having one question. Like if we give the Botox to the patient, do we need to give it again, or is it a permanent treatment?
No, it's not permanent. There's nothing permanent in aesthetics, number one. Number two, Botox is not permanent. The Botox effect lasts for 3 to 4 months.
What is the duration, Piyush, for Botox?
Let him answer.
We need to go to their frequency and probably you need to tell them also.
Yeah.
So yeah, Botox is to be given every 3 to 4 months, whether we are giving for functional like hemifacial spasm, blepharospasms, or for cosmetic treatments. There is nothing called permanent with Botox. And also, I have not touched specifics on Botox and fillers. I've not gone to that basics because it was an overview. But just to now, because the question has come, Botox is given for wrinkles, dynamic lines, so expression lines. So when your muscle is contracting, we relax the muscle by Botox because it works on an acetylcholine receptor. Okay. But fillers is something which is filling, as you say, filler. So we fill it up. So if I have a nasolabial fold, if I have a hollowness here, if I want to build up my face, change the shape of the face, volumize my face, lift my face, decrease my face, it's all about fillers. Fillers is semi-permanent. It will last you up to a year or 9 months, but again, you have to do it. So nothing is permanent. Even surgeries have to be repeated.
What is the material used for fillers? Shubhra?
Yeah, so fillers are of different types. So there are synthetic fillers and autologous fillers. Autologous fillers is fat, which is our own fat, but synthetic fillers is mainly hyaluronic acid. In India, we are using mainly hyaluronic, but there are calcium hydroxyapatites, there are silicone fillers, there are collagen fillers, but the variety. But the most of the world now has shifted to hyaluronic acid fillers because they can be reversed. So if any complication is happening, or there is an not so good result which has come, overfill, underfill, you can play around with hyaluronic acid filler in a better way.
Any other
So we-
postgraduate? I think everyone is.
So they can tell about the indication of Botox.
Sorry?
Indication of Botox.
These residents,
Acha.
for residents.
Residents, you are asking the residents or ask by name. Mihir.
Okay, Dr. Piyush.
Anjali is there.
Piyush is there. But Anjani Agarwal.
Acha, rest, Anjani lips.
At the moment you're asking questions, they're logging out.
Yes, sir.
No.
Yes, sir.
Anjali, come with the video. Anjali, come with the video.
Turn on the video, Anjali. Yeah.
Yes, sir.
Turn on your video. Yes. No.
Any query
They're all
from
scared.
side?
They are all scared actually.
No.
Actually,
He's there. Please
yeah,
ask the
okay.
question. Repeat the question.
Yeah,
sir,
yeah.
I want to
Indication
ask
for
about
Botox.
the
Yeah.
so you indications of Botox.
Yes.
Sir,
Mostly
normally
wrinkles.
these are wrinkles, eyelid, like facial
No. You can divide into two types. Okay. One is therapeutic.
cosmetic and therapeutic.
Yes. So therapeutic, you can tell what are the therapeutic and what are the cosmetic.
So therapeutic, we can go for blepharospasm, hemifacial spasm, then dry lacrimal gland hypersecretions, and for aberrant regenerations.
So
and
what that cause?
Aberrant
Like I
regeneration of for like crocodile tears or
Aberrant regeneration
abnormal
can be
facial
anywhere.
movements.
Yeah, aberrant regeneration
Right.
can be anywhere on the face with facial nerve injury or paralysis. So it can be done. And that's a good answer. Another therapeutic indication is when we want to cause a chemical tarsorrhaphy. Okay, so if patient is bedside, has corneal ulcers, and you don't want to do, and tarsorrhaphy is an outdated procedure anyways, we don't do it. So we do Botox to cause a total ptosis, or we can even do filler in the pretarsal or the septal space to do a lid loading to bring the eyelid down. So that is your functional indication.
Ma'am, I want to ask one thing about the non-surgical blepharoplasty. Can we perform non-surgical blepharoplasty in all cases where we would have performed blepharoplasty?
No. So it is only for grade 1, grade 2 skin laxity. If the laxity is, you feel the laxity. Okay. So I don't know if it is very visible. Now, if you see, I have grade 2 laxity. Okay. So I'm a good candidate for non-surgical blepharoplasty. But if somebody has huge bags here, hanging skin, I showed you some pictures. Those candidates will not do with non-surgical blepharoplasty. You have to do surgery. If there is any residual laxity, you can do non-surgical because plasma does not work on eye bags, on fat pads. It works only on skin laxity and collagen tightening.
Ma'am, it works on muscle also or what?
No.
Like in blepharoplasty, we remove the skin and muscle.
Yeah, it doesn't work on the muscle. We are only working on the skin. till the basal lamina. We are not going even into the dermis. It's only the epidermis and basal lamina. So how
Thank
it
you.
works is to give you an idea. I mean, that's beyond, little bit beyond your level, but epidermis, basal lamina, dermis. Dermis has all your fibroblasts, collagen, oil glands, vascular structures, melanin cells, everything. You slap the epidermis and basal lamina, this will start working. That's the basic principle of any skin treatment. Okay. So we are exciting the epidermis and basal lamina for the collagen to develop because there's an epidermal insult happening.
Ma'am, we have to go for only one session or we have to go for multiple sessions?
Depends on the laxity. If it is mild, one session works well. But if it is mild, moderate, we have to go for 2 to 3 sessions alongside cosmeceuticals. We have to add a lot of other things to, strengthen your skin from within, like collagen supplements, IV infusions, cosmeceuticals, a lot of things we give.
Thank you, ma'am.
Pleasure.
Chandana madam, are you there?
Yeah, Dr. Chandra madam is there. Yeah.
Hello.
Ah,
Actually, I'm traveling, so that's why I couldn't open my mouth.
okay.
A very good evening to all of you.
Thank you.
After
Good
listening
evening.
this fantastic lecture, I don't have much to say. I just want to share my experience with. We are in a government medical college. Basically, we are practicing therapeutic, not facial aesthetics and therapeutic. We are doing, yes. Today only I did this thing, apraxia, eyelid opening, those lid opening apraxia, visual apraxia we said. The problem is that 2 weeks back I gave the patient almost 50 unit of Botox. But this is the first time when I'm saying the patient has come back to me only after 2 weeks of having the Botox. But this is a difficult case, the different case, I will say, apraxia, which doesn't always respond to this Botox. So what is your experience or any of the others who have joined as a panelist? If you have any experience about the Botox in lid opening, apraxia in eyelid opening?
Yeah, ma'am, I think apraxia is not easy to treat because it's a complex entity, and most of these patients may come back because they are non-responders. So we may have to change the brand of the Botox which we are using. So if you're using Botox by Allergan, for example, you can go to Dysport. That is number one. Number two, 50 units is too high for the patient for apraxia. I would restrict myself to 10 to 15.
Both sides.
Yeah.
Both sides.
Yeah, but I would still restrict myself to 10
15
to
to 20.
15 units to begin with, because we're just working here. We are not trying to work on the forehead or periocular area to begin with. But I agree, and it's not easy to treat apraxia. It's not easy. And also we need to rule out why the apraxia is happening. Is there any other associated disease process like Parkinsonisms or any other neurological disorders?
MRI, to most of the cases, this type of patient, they don't have anything in the MRI, but routinely we do it.
Yeah. I have my savior, Dr. Rashmin Gandhi. I refer all the patients to him, the
Neurologist opinion.
neurologist to see and
So
tell
the
me
best.
what's happening.
Yeah.
But yeah, jokes apart, it is tough, ma'am. It's not easy. Apraxia is not one of the easy cases to do. They keep coming back to you.
Okay, thank you, Dr. Shubhra. That's
you,
wonderful.
Thank you so much. Thank you for your presence.
So Botox, one of our important point is the efficacy part. So sometimes because it's a one-time injection drug, usually like a disposable. So once it is reconstituted, we have to give it within a certain period of time, mostly 24 hours, better, or 72 hours, maximum 96 hours. So, but still we, because of our OPD numbers or the patients who come to us, so may not be that much for your 50 units. So we have to keep it for longer period of time. So that we have to also understand that the efficacy reduces over period of time. So as you inject it, you have to know that you are giving a concentration which was there in the initial first day, but now it has reduced to half of it maybe. So we can inject it more, or we can supplement it with the newer bottle. So that is also one point which you have to take care while giving Botox for mostly therapeutic uses. And moreover, we have to explain patients to be realistic, because in my clinic, whenever they come, they ask that how many times you have to give again. So once they know that it has to be repeatedly given, the hesitation starts, because the compliance part will also be there. So my counseling is mostly that it's not necessarily that it will work for only 12 weeks or 3 months. It may extend to certain period of time, like 6 weeks or 6 months or 9 months. So it's not necessarily that we have to go for a repeat dose in 3 months. So that way they are convinced at least, and that, yeah, that will work out.
Dr. Lipsa, would you like to ask some questions, or you want to answer something? Lipsa.
You told that plasma treatment in pterygium surgery. Can we keep graft in this case?
Plasma treatment in?
Pterygium surgery.
Oh, okay. So first of all, it depends what are the stages of pterygium, so there is mild, grade 1, grade 2, grade 3, encroaching the cornea and everything. So you need, if it's approaching the cornea, you have to shave it off from the cornea, and the rest can be done with the plexer. And yes, you can put an AMG if the need is required. It depends on the raw surface which you have.
Anybody else? Nista? Dr. Nista?
Hello. So same question about how we can the plasma is benefit in pterygium. So she has already asked.
Okay. Yes.
Dr. Shubhra, I have a question.
Yes.
You said that there is evaporation. What is that like? How you do use plasma to evaporate small growths?
So it's evaporation is like a layman's term, ma'am, but basically it's causing sublimation. See, plasma as an energy form, if you look at the lightning energy, also is plasma. Nuclear bomb is a plasma. Atomic energy is a plasma. So plasma is never going to cut. It's only going to take it off. So it sublimates. That's a characteristic of plasma. Now, the beauty with the plasma pen is that if you touch it to the skin, you're cutting and coagulating. So it becomes like a normal laser. So the plasma is produced when the tip is between the skin. So you don't have to touch the skin. It is the air interface between the lesion or the skin and the tip which produces plasma because of the ionization of the molecules which happens. And that plasma energy which is produced like you saw that red arc, is the energy which is going to sublimate it. So when I'm performing, I've not shown the videos today because of the paucity of time. But when we do it, let's say I'm doing xanthelasma, I'm doing plasma, I keep wiping it off. You can actually see the black skin as submilated tissue which is coming off. So you will not see the lesion. You will see it as an evaporated mass coming out. It's very beautiful.
Yes, Chitrangada, what to say?
Good evening, sir. Good evening. Good evening, ma'am.
Good evening.
Good evening, teachers. Ma'am, I wanted to ask, as a resident, we are clear about oculoplastic fellowship and aesthetic surgery. That's a different thing. We know that. We know where we can apply for oculoplastic fellowships, which will be 2 years or maybe shorter. But ma'am, what about aesthetics? Like if we just want to do aesthetics, now how do we know as residents that which is an authentic place from where we can learn? Because there are a lot of doctor clinics and there are a lot of beauty parlors also as well who are, giving courses on aesthetics. So how do we know as residents that which is an authentic place to apply for it?
Beauty parlors giving courses in aesthetics. That's news.
Yes, ma'am.
Okay. I didn't know that.
Yes,
Yeah.
ma'am.
They do that.
But yeah, see, I think I touched upon that. If you heard my talk, what do you? So okay, I question you back now. What do you want to learn in aesthetics? What is the
Ma'am, I
meaning of
want-
aesthetics? 1 second. What is the meaning of aesthetics for you when you say short-term course in aesthetics?
Ma'am, for me, I think it just means something non-surgical, Botox and fillers mainly. I guess maybe CO2 laser, but not much of the surgical part, which we
That
do in
becomes
oculoplastics, I
cosmetology.
guess.
Okay, so that becomes cosmetology. Aesthetics
Okay.
is a very broad terminology. Let's correct it first, okay? I'm just
Okay.
pointing fingers. Now, cosmetology courses you can attend anywhere. You can come to us. You can have so many organizations which are teaching you Botox fillers. Even companies are teaching Botox fillers. Lasers, laser people can come and teach you. I mean, the companies themselves have training programs which can do. But if you need to, where is she disappearing?
Yeah, I'm right here. I'm right here. ma'am.
Okay.
Sorry.
But if you need
Bad network.
certified courses, then there are a lot of organizations which do for you. So if you want to just learn non-surgical, now non-surgical is again a lot of them. Threads are non-surgical, Botox is non-surgical, filler is non-surgical, laser is non-surgical, plasma is non-surgical. Lasers, there are 10 types of lasers. Okay. So
Yes, ma'am.
yeah, so that's called cosmetology. That's a cosmetology thing which you are adding to your practice. There are a lot
Okay,
of
ma'am.
not beauty parlors for sure. I would not suggest
Yes,
that.
ma'am.
But go to authentic organizations, institutes in India or abroad where you can get these certified courses. That's not a problem. PRP,
All right.
I've not touched PRP. You do skin PRP, hair PRP. So a lot of things are being done where you can learn that.
Right. All
Very
right.
task. Yeah.
Okay. Thank you, ma'am.
Dr. Subra, do you have any training program in your hospital, Apollo? And what is the duration?
Not in Apollo, sir. I do it on my own.
Okay.
So yeah, Botox fillers I do very routinely. I am not into lasers training and everything because I've never ventured into it. But we have dermatologist friends who do it. Botox fillers, plasma, PRPs. I have all kinds of training, sir. Even blepharoplasty.
Any kind of a structured program like 1 week or 2 weeks, something like that in your clinic?
I can tailor make for anybody. If they want
Okay,
2
right.
days,
So
I
they
can
can
train.
directly contact,
Yeah,
they can get in touch with you and you can.
Yeah. 2 days also you can learn. See, and you cannot learn everything in 1 week. It's
No,
impossible.
just like when one topic on Botox, if he wants to learn, he can come to your clinic.
Absolutely. I have done courses for Botox for 1.5 days, 2 days. Because as ophthalmologist, you would like to first learn the upper face and not venture into the advanced indications. So learn the upper face, practice it, come back, learn the thing. So you learn one module, go and practice, and we are there to handhold because see, a lot of people, what they come to me and they learn and they never go back and practice. So that is something which is waste of time and energy. So I always tell people who are serious about learning, please come, go back and practice it because unless you practice, you'll not know and will not have the courage to go to the advanced indications, which is very easy to do. It's not a big deal. It's just a mind block in our circle that we can't do it.
Okay, any other questions or we are going to wind up?
Yeah, I think if we don't have much discussion, let us wind up. So, on behalf of this EIZOC ORTS series,
Sir, Lisa has one question, I think. She was
Nista and Juhi, the two people have not probably.
Lipsa was going to ask.
Nishta and Mishra and Juhi.
Nista and Juhi. They want, they can come up and otherwise Dr. Subudhi is there to wind up and say vote of thanks, give vote of thanks.
I think everybody is covered. All of them have covered.
Okay, sir.
So yeah, I think we should wind up. So I thank Dr. Subra Goel to come and give us a wide picture of this aesthetics. So I think our knowledge has improved and our postgraduate students have also learned a lot today and they've seen a lot of aesthetics. If not practicing for others, they can practice for themselves also. So I thank our president, Dr. Pranab, to give us a initiating welcomes and also sitting with us till the end. Thank you very much, Dr. Pranabji. Our panelists have done a good job. Dr. Meir and Dr. Sarmishta, Dr. Chandana Madam has done very well. So overall, the postgraduate students definitely have enjoyed because they have interacted with the speaker very much. And last but not least, our mentor, Dr. Ajit Babu, who has selected the good speakers to give us an insight to various aspects of oculoplasty. So these few words, I thank you all for joining us. We'll be meeting again, webinar series, what is 24th, maybe end of this month. Thank you very much. Good night.
Thank you, sir.
Thank you.
Madam,
Good night.
Thank you, Shubhra, for accepting the.
Thank you.
Finally, thanks to Todd for giving us.
Rahul, would you like to say anything? Are you there?
Yeah, Mr. Rahul is there.
No, Rahul is not. Rahul is always starts and goes away.
Usually, yes, you will not be there.
So thank you, Entered, for giving us the platform. Thank you, Rahul, staying with us. Bye. Good night.
Okay.
You can close.
Good night.
Mr.
Good
Rahul
night.
can close.
Okay.
Rahul is not there.
Okay, good night, sir. Good night.
Okay,
Good night.
okay, sir.
Sir,
Okay.
Good night, sir. Okay, good night.
Dr. Pranabji, I sent a message. Please reply that in the evening or night to tomorrow morning. Okay.
I've not seen the message, so I'll just see and reply.
Send the message.
I've not
Okay,
seen
bye.
the-
Bye. Bye. Then.
Okay, sir.
Good night.
Right. Okay, good night, Chanda ma'am.